Hello, everyone. This is Eric Coley, and I am going to be conducting a walkthrough of the point of care ultrasound checklist process. For this walkthrough, we're going to be using the musculoskeletal or mechanism of injury version of the checklist. Essentially, the process will be the same for each of the checklists that are released. So this walkthrough should be able to help you out with any of those. So just a quick glance over the document. It is a two-page PDF fillable document with a reset button on the top. Um, Roughly, let's see, we've got 12 sections and some final comments to close the document out. And here we go. Section 1, patient assessment and history. You will essentially check off that you have completed each of the components in this section, which include obtain a detailed history, include risk factors associated with trauma and MOI, such as time of injury, physics, and any other relevant medical conditions. Now, this doesn't mean include this information in this checklist. It's checking off that you've included this information in your EPCR. Review any physical examination findings, possibly indicating the need for musculoskeletal MOI scan, uh, soft tissue damage, deformity, unilateral limb swelling, pain, warmth, etc. Prepare and organize a sequential patient report to present the case signs and symptoms to side support. So obviously this information is collected and prepared prior to your consultation because you do have to have a consultation with topside support to perform point of care ultrasound examination. So then the next section, section 2, TSS consultation, POCUS as applied for use to supplement patient examination, required TSS consultation and approval prior to performing the scan. So POCUS is a supplement to the expanded scope clinical examination. POCUS as applied for continued proficiency training does not require TSS consultation or approval, but does require documentation via the POCUS supplemental report form and this checklist. So again, you do not have to have topside consultation for training scans, but you do have to have documentation to support any completed training scans. Section 3, preparation. Verify patient identity, informed consent, any allergies, gather necessary equipment, ultrasound probe, linear or curved. In our case, it's all three probes in one. Your ultrasound gel, PPE, towels, anything that you're going to need to support the patient's position of comfort. And then anything in this particular case to complete the musculoskeletal or MOI assessment. Patient positioning. This is going to be a position of comfort depending upon the particular presentation. You may need some rolled up towels, some pillows, or something like that to support a limb if it's in a bent configuration or, whatever the case may be. So just think ahead. Expose the area to be scanned while ensuring privacy. And only if you have to move along, only keep the area that you need to scan exposed. Don't just expose the whole patient and then have a blanket laying next to them and realize that they're not covered up. Be prepared to perform bilateral limb scans for comparison and normalcy. So if you have a injured hand, be prepared to scan the unaffected side for comparison. Equipment setup. This is specific to the butterfly itself, so you do have to make sure, obviously, you turn the probe on, and you may need to go ahead and set your depth, your gain, and your focus in order to capture the best images. You also may have to check uh, you may also have to check your cables to make sure that your probe is connected. Section 6, aseptic technique. We're not doing any type of internal scanning. So good hand washing and good disinfection of the materials that you're using should be sufficient for most of the exams that we're doing. When anything is in question, again, consult operations and or topside support for guidance, but that general perspective should carry out through most of the exams that we'll be conducting. Probe placement. Um, Obviously, we've got the one probe with three different settings, which will be the phased array, the curved, and the curvilinear type probe. Depending upon the location of the body and the potential depth of what you're trying to capture, where you think the problem might be, you may have to make some other adjustments, and we'll cover that more in the in-service for the butterfly itself. Place the probe on the skin over the suspected area or entry site, adjusting the probe orientation for longitudinal or transverse views as needed. Now, when there's an obvious deformity or something painful, we're not looking to directly press the probe into that painful flesh. In some cases, we might have to consider some type of pain management prior to, or we also might start around the circumference of an injury and kind of work our way in. This actual scan itself, we will start in B mode and we'll visualize the injured area and surrounding tissues. We do have a quick reference guide that we'll be creating. That'll have some images that'll help guide your scan, that you can refer to, that you do not have to submit the quick reference guide as part of your patient documentation. Observe for any signs such as tears, fluid collection, deformity, or foreign bodies. You can use color dynamic scanning to assess for any motion abnormalities in the affected area, and motion abnormalities can refer to structural motion or even fluid motion. Recognize normal versus abnormal findings on ultrasound images. Correlate the ultrasound findings with the patient's clinical presentation and the mechanism of injury. Communication basically is following up with your PIC, your patient, and your topside support physician once these images have been captured. That way you can discuss as a team the next steps for patient care. So the post-scan steps are number 10, remove and dispose of your PPE appropriately, clean and disinfect the ultrasound probe according to the provided instructions, ensure patient comfort and any other necessary post-procedural care, communicate your findings promptly, and then documentation is going to be completing the EPCR, completing the supplemental report form, and completing the appropriate POCUS checklist and submitting all that together. Then lastly, we've got quality assurance. Only technicians that have been gone through the training and been checked off for each specific type of scan can perform each scan. Now, the expectation for technicians that have been checked off is that they, from a continuing education perspective and the ability to obtain proficiency, will have to complete 20 musculoskeletal or MOI scans per quarter. Now, in a lot of cases, that's as simple as scanning yourself or scanning your own leg. Now, you will have to document here at the bottom. First, you put your name, your work location, and the date completed. Is this a patient scan? Yes or no? Is this a training scan? Yes or no? Was any pathology identified? Yes or no? Was there a secondary finding? Yes or no? So patient scans should be straightforward, right? You've actually got a patient, you have a presentation, and you have approval from topside support. You're conducting a patient scan. If you're practicing on a mannequin, you're practicing on yourself, or even if you're practicing on a coworker, you don't have to have topside support, but you do have to document it. You would just indicate, yes, this is a training scan. Was pathology identified? Well, if it's a training scan and you're doing it on another person, hopefully there was no pathology identified. Um, if you're doing it on a mannequin that say the mannequin hand has a broken finger and you identify it, well, then you would identify yes. A secondary finding. What is a secondary finding? Okay, so based upon a particular presentation, you're looking for a a fractured finger, and what you find is a tumor in the hand. You find a tumor around the knuckle, or you find some other type of defect that is notable, but it's not what you were looking for. It still needs to be addressed. It probably even needs to be referred to, another type of provider to deal with it, but it's not part of the primary or the chief complaint or the reason why the patient's in the clinic, but it's notable. That is a secondary finding, and that is worth reporting if you identify one. Now, all of our films or our images will be interpreted by a radiologist, so it's more likely that the radiologist is actually going to find something secondary and report that back to us. But nonetheless, This is the check sheet as it currently is, and it's just as simple as checking each of the boxes as you recognize that you've completed that action. And when you have a form that you need to reset, you click the reset and it clears everything. So that's all for the checklist. If you have any other questions, reach out to operations or you can contact me and we'll do the best we can to support you. Thanks for your time.